Lighthouse Surgery Center is located in Hartford, Connecticut. We are a state-of-the-art orthopedic surgery center. We have 6 ORs. We have 1 procedure room. We're about 35,000 square feet. We specialize in total joint replacements, sports medicine, spine procedures, and also pain management procedures in our procedure room.
I've been in orthopedic surgery for almost 30 years. As an orthopedic surgeon, you build your practice and you love to take care of your patients. And over your career, you get better at that. And then you get to the point where you realize that I need to also have better control over the surgical environment. And that's kind of the key and the reason why Lighthouse Surgery Center came into being.
I was part of the project from the ground up, the planning process before it was even built, the groundbreaking process, the design and construction, staffing it, all the equipment, different vendors, insurance contract negotiations, you name it, I was part of the process.
Stryker has a really well-done ambulatory surgery center division now they work with right from the beginning. It's already integrated. They're bringing together a lot of different elements of Stryker right from the onset. This gets into why we started with Stryker kind of early, because you don't have endless time. So we met with them because they could bring so many pieces of the puzzle kind of at once and do that with one group of salespeople, one group of installers, one group of installation engineers. The simplicity of it when you're in the hectic moments of building a surgery center was immediately appealing.
There are many benefits to having a single vendor to make us a cohesive facility. And when we go to Stryker, they're really able to help us and we only have to go to them. They have spine, they have sports, they have the total joints, they have trauma. We work with all of those. They're dependable, they're reliable. Stryker has always been there to help support us. One vendor it just brings it all together. It kind of wraps it all up in a nice big bow.
The most important single piece of advice is it's a big task. Break it down into little teeny doable parts and just knock them down one at a time.
So our educational partnership with Stryker has kind of evolved since we've opened over the past 3 years, working with other facilities, inviting them to come here and listening to the path that we walked. It's about growth and development. They come and they meet with us, they meet our leadership team together, and we talk about what they might like to achieve. They always have questions right out of the gate, and then we take them on a tour of the facility. And I really think when we open ourselves up to other facilities, they come here, they learn from us. We talk a lot about lessons learned. And I think if we're able to help them on any of those levels, it's beneficial to them.
But I think the results of our center and how our patients do show that it is an excellent model. And if I can help through education, other surgeons get this process running on their own, I think that's a really important mission for me. Over the last several years, I've had the opportunity to do a lot of peer-to-peer experiences. And every group I've met comes with some tremendous strength, which I think is why they're on this pathway to get their own center or to build their center bigger. But they also have some apprehension about the parts of the puzzle they don't think they completely understand. So when we have a peer-to-peer relationship, because we have a completely finished, up and running surgery center, they know from the onset that when we not be the best at everything, we do have all the pieces to the puzzle.
I would say your focus is patients. It's always patient-centric. You don't ever want to lose that goal. You always want that at the center of any decision that you make.